So to reduce that breast cancer incidence and the death by the breast cancer, this screening mammogram awareness is required. So we advise most of women after the age of 45 years to go to their nearest doctor, nearest diagnostic center and get the screening mammogram done. So this is about the early diagnosis and treatment of the breast cancer. Coming on to symptoms of this breast cancer. So already I have told, commonest symptom is the painless lump. So only when it advances, then there will be discharge from the nipple, there will be ulceration in the skin, and then the breast itself may come down in size. So these are the other symptoms of breast cancer we usually come in the clinical practice, but these are in the advanced stage. So what are the stages of breast cancer? It may be in stage 1 or stage 4. Stage 1 is, it is restricted only to the breast. Stage 2, 3 is within the breast but advanced to the local structures. Stage 4, it has gone to some other organs like liver, bone. So we call it as a stage 4 disease. So any breast cancer which is detected in stage 1, stage 2 can be cured, whereas it comes in stage 3 or stage 4, we can only control the disease. So what are the treatment available for this breast cancer? We have surgery, we have chemotherapy, we have radiation, we have hormonal therapy, we have biological therapy, we have targeted therapy, we have immunotherapy. So what are the things? Breast cancer can be treated by all these modalities, but which is required for you, it will be decided by your doctor. So you have to consult your doctor. Once they, depending upon the stage, they are able to advise. So any particular stage of disease, all the 3 modalities of treatment like surgery, chemotherapy, radiation is required, but which is first will be decided by the doctor. So this is about the treatment aspect. So early diagnosis is the must. Any painless lump, you should go to your doctor and get it checked. So one more aspect of the breast cancer is the familial history of breast cancer. So if a familial gene is present, familial gene is positive, we call it as a BRCA1 gene or BRCA2 gene. So if this gene is present in the family, and it occurs only in the 5% of the general population. Suppose 100 breast cancer if we take, only 5 people we can say it is caused by the familial genes or BRCA1, BRCA2 genes, which can cause breast cancer and ovarian cancer in the family. Any person in that family is detected with this BRCA1 gene or BRCA2, the subsequent family members, suppose mother is detected, the daughter is going to be affected almost 85 to 90% of the time. So in those females, the familial members, usually we advise screening with the BRCA gene testing, and if they are also tested positive, we do the screening mammogram at earlier stage, and there is a option of preventing these breast cancer and ovarian cancer by so many methods. One is removal of both breast, which is very aggressive, which can be consulted with the surgeons and the medical oncologist together, and we can take a decision whether we can strictly intensive screening monitoring is required or do the prophylactic mastectomy or prophylactic removal of the breast. So these are about the breast cancer treatment, diagnosis and genetic factors. So for more information about the breast cancer, you can contact us for details and we will get back to you. So one more thing I want to stress about our campaign, Mom, It's Time for Mammogram. Please get awareness about the screening mammogram. Educate your daughters, your relatives, your friends about getting the screening mammogram done after the age of 45 years. So this definitely will prevent the breast cancer in their family or breast cancer related deaths in the family. So we will meet in our next video. Thank you.